The esophageal cancer diagnosis came 12 weeks before the family brunch I'd never forget. I was 29 working as a software engineer when I couldn't swallow food anymore and started coughing up blood. The endoscopy showed a tumor blocking my esophagus. Stage 3 adenocarcinoma requiring immediate surgery and chemotherapy. Dr. Michael Chin was the chief of thoracic oncology at Westside Medical Center. He showed me the imaging with direct honesty. This is advanced and aggressive. We need to operate within 3 weeks. Esophagectomy, remove part of your esophagus and stomach, then chemotherapy. Without treatment, you'll be unable to eat within weeks. You have maybe 4 months. I called my parents that evening. Dad answered, his voice impatient. Alex, I'm with patients. This better be urgent. Dad, I have esophageal cancer. I need major surgery. Silence. Then, esophageal cancer? At 29? That's ridiculous. You probably just have acid reflux or an ulcer. My father was a gastroenterologist with his own practice. My mother was a nurse practitioner at the same clinic. Both were convinced their decades of experience made them infallible. Dad, the endoscopy showed a malignant tumor. Endoscopies miss things all the time. Who did it? Some random GI fellow? I've been doing this for 30 years, Alex. You don't have cancer. You have anxiety causing esophageal spasms. 3 different doctors confirmed. Then they're all covering for a bad initial read. That's how hospitals work. Dad's voice hardened. Look, we're hosting the quarterly family brunch next month. All my colleagues and their families will be there. I don't need you spreading cancer panic and making me look bad. Take some Prilosec and stop being dramatic. The surgery was scheduled for 2 weeks out. I told my family at Sunday dinner. Both parents came in their medical scrubs, having just closed the clinic. You're actually scheduling this surgery? Mom set down her fork. Alex, this is insane. You're letting some surgeon convince you that you need to have your esophagus removed. Mom, I can barely swallow. The tumor is blocking. Tumors can be benign. Did anyone actually say malignant, or are you catastrophizing biopsy results? She exchanged looks with Dad. Who's this surgeon? Michael Chin? Never heard of him. Probably some junior attending trying to build his case numbers. He's the chief of thoracic oncology at Westside Medical Center. That's a mid-tier hospital at best. Your father and I work with the best specialists in the city. If you actually had cancer, we'd know. Dad's voice was firm. Cancel this surgery. Come to my clinic. I'll do a proper endoscopy and show you there's nothing wrong. I've had 3 endoscopies. All misread. This happens constantly when fellows do procedures unsupervised. Mom's voice turned cold. Honestly, Alex, this feels like attention-seeking. You've never liked that your father and I are successful physicians. Now we're hosting a major networking brunch and suddenly you have cancer. The surgery happened on schedule. My friend Chris took a month off to care for me. My tech company told me to take all the time I needed. My parents sent a text. Hope you realize this was unnecessary. See you at brunch in 10 weeks. Dr. Chin spent 11 hours removing the cancerous portion of my esophagus and part of my stomach, reconstructing my digestive system using my intestine. The pathology showed aggressive adenocarcinoma with lymph node involvement, exactly as diagnosed. I woke up unable to eat normally with a feeding tube, facing months of recovery and chemotherapy. Chris stayed every day managing my tube feedings, helping me through complications, holding my hand through the reality that I'd never eat normally again. My parents visited once, 5 days post-op. They walked in together, both in their medical attire, projecting professional authority. So what did they actually find? Dad asked, barely glancing at my surgical scars and feeding tube. Stage 3 esophageal adenocarcinoma. They removed the tumor along with lymph nodes. Dad waved his hand. Staging is subjective. What one pathologist calls stage 3, another might call stage 1. This doesn't prove you needed such extensive surgery. Dad, they removed cancer from multiple sites. Because Chin is knife happy. I bet a competent gastroenterologist could have managed this medically. He looked at the feeding tube with disgust. Now you're stuck with that thing. This is what happens when you ignore experienced physicians and listen to surgeons. Mom nodded. You made a terrible decision, Alex. But you'll be recovered for our brunch, right? We're hosting every major physician in our network. We need you there looking healthy, not drawing attention with medical equipment. I have a feeding tube. I'll have it for months. Then hide it under your clothes. And don't mention the surgery. Just tell people you had a minor procedure. Mom's voice was sharp. Your father's reputation depends on projecting competence and success. Having a son who made such poor medical decisions reflects badly on us. They left before Dr. Chen came for rounds. What my parents didn't know, what they'd been too arrogant to discover, was that Dr. Michael Chen wasn't just any thoracic oncologist. He was the majority owner of Westside Medical Center and 3 other hospitals in the region. He'd built the facilities from the ground up, recruited the best specialists in the state, and maintained the highest surgical success rates in the country. My parents' clinic leased space in a building owned by Dr. Chen's hospital network. Their malpractice insurance was through his system. Their referral partnerships depended on his facilities. The recovery was brutal. 8 weeks post-op, still unable to eat solid foods, learning to manage life with a reconstructed digestive system. The chemotherapy started. Brutal infusions that compounded the surgical recovery. Chris coordinated care with my friends. My parents called once. Alex, the brunch is in 2 weeks. You'll be there, right? And looking presentable. 10 weeks post-surgery, I was barely strong enough to stand for long periods. But my parents insisted. This brunch is crucial for our practice. Every major physician in the city will be there. You will attend and you will not mention your medical drama. The family brunch was at an upscale restaurant overlooking the city. I arrived with Chris, still weak, my feeding tube hidden under a loose shirt. The private dining room filled with physicians, specialists, hospital administrators. My parents' carefully curated professional network. Dad held court near the bar, Mom beside him, both introducing colleagues and discussing their thriving practice. When they saw me, Mom hurried over. Alex, you look terrible. Did you even try to make yourself presentable? Mom, I'm 10 weeks post-esophagectomy. Stop using medical terms to get sympathy. Just smile, stand up straight, and don't mention your surgery to anyone. She glanced around nervously. We've told everyone you've been traveling for work. Keep it simple. The brunch began. Physicians mingled, discussing cases and medical practices. My parents networked aggressively, handing out business cards, discussing their clinic's growth. Then I saw Dr. Chen enter the room. He wasn't supposed to be here. This was my parents' event, their network. But he walked directly to the host's stand, spoke briefly with the manager and scanned the room. His eyes found mine. He walked over immediately. Alex, I didn't expect to see you here. How are you feeling? Better, Dr. Chen. Still adjusting, but better. My father appeared beside us, his professional smile plastered on. Excuse me, this is a private event. I'm Michael Chen. He extended his hand. I'm Alex's surgeon. Dad's smile froze. You're the surgeon who, you operated on my son? I performed an esophagectomy for stage 3 adenocarcinoma, yes. Dr. Chen's voice was pleasant but firm. Alex is one of the bravest patients I've treated. Stage 3 esophageal cancer at 29, facing an 11-hour surgery and aggressive chemotherapy. Several nearby physicians turned to listen. While we still think the diagnosis was questionable, Dad started. Questionable. Dr. Chen's expression hardened. Are you suggesting 3 endoscopies, multiple biopsies and pathology confirmation were all wrong? I'm a gastroenterologist with 30 years of experience. I've seen cases like this turn out to be nothing. Cases like stage 3 adenocarcinoma with lymph node involvement? Dr. Chen pulled out his phone, tapped something. Mr. Harrison, you're Alex's father? Dr. Harrison. I run Harrison Gastroenterology Clinic. The clinic that leases space in my medical building. Dr. Chen's voice went cold. The clinic whose malpractice insurance I provide. The clinic that receives referrals from my hospital network. The color drained from Dad's face. You told your son, my patient, that his confirmed esophageal cancer was probably nothing. That 3 endoscopies were misread. That he should skip surgery for a brunch. Dr. Chen looked around the room at the gathering physicians. Everyone here should know. Dr. David Harrison is a gastroenterologist who cannot recognize esophageal adenocarcinoma. Who told his dying son to take Prilosec instead of getting surgery. The room went silent. Every doctor turned to stare. Mom tried to intervene. Dr. Chen, this is a family matter. Are you Carol Harrison? The nurse practitioner at the same clinic. Yes, and I don't appreciate. You told Alex his cancer was attention-seeking. You instructed him to hide his feeding tube at this brunch because it would make your husband look bad. Dr. Chen's voice carried across the room. A nurse practitioner who prioritizes social appearances over post-surgical cancer patient care. A hospital administrator I recognized from Westside stepped forward. Dr. Chen, are you saying the Harrisons dismissed their son's cancer diagnosis? I'm saying Dr. David Harrison, a gastroenterologist, told his son that stage 3 esophageal cancer was probably just reflux. That Carol Harrison, a nurse practitioner, called cancer treatment medical drama. That they both pressured Alex to attend this brunch 10 weeks post-esophagectomy to avoid damaging their professional reputation. The administrator pulled out his phone. The Harrisons have referral agreements with Westside? Not anymore. Dr. Chen's voice was ice. Any medical professional who cannot recognize esophageal adenocarcinoma in their own son is not someone I trust with patient referrals. Dad tried to speak. Dr. Chen, you're overreacting. Am I? Let me share what else I know. Dr. Chen pulled up his phone. Alex came to my office unable to swallow, coughing up blood, with a 3-centimeter tumor blocking his esophagus. His father told him it was anxiety. His mother told him to take antacids. By the time I operated, the cancer had spread to lymph nodes. If Alex had waited the 2 more months his parents demanded, he'd likely be dead. Gasps rippled through the room. Physicians shook their heads in disbelief. The medical building lease for Harrison Gastroenterology is up for renewal next month. I'm recommending we don't renew. Dr. Chen looked at the administrator. I'm also recommending review of all patient referrals from that clinic. If Dr. Harrison can't diagnose esophageal cancer, what else is he missing? You can't do this, Dad's voice shook. I've practiced medicine for 30 years. And in 30 years, you've learned that a 3-centimeter esophageal tumor is reflux? Dr. Chen stepped closer. Your son has a feeding tube because I had to reconstruct his digestive system. He'll never eat normally again. He's facing 6 months of chemotherapy. And you told him to skip surgery for a brunch. Mom was crying now. Several physicians they'd been networking with moved away, distancing themselves. The administrator spoke quietly to Dr. Chen, then addressed the room. For anyone here who receives referrals from Harrison Gastroenterology, please be aware that Westside Medical Center is conducting a review of their diagnostic competency. We recommend seeking alternative referral sources. My parents' carefully built network crumbled in real time. Physicians they'd been courting suddenly remembered other appointments. Business cards were pocketed. Professional smiles disappeared. Dr. Chen turned to me. Alex, you shouldn't be here. You need rest. Let me call you a car. I can drive him, Chris said firmly. As we left, I heard my father trying to explain, my mother apologizing, both of them realizing their professional reputations were destroyed. The investigation moved quickly. Dr. Chen's hospital network reviewed every patient referral from my parents' clinic. They found multiple cases of misdiagnoses, delayed treatment recommendations, and patients who'd been told their symptoms were anxiety or stress when they had serious conditions. Within 3 weeks, my parents' clinic lost their lease, their malpractice insurance, and most of their referral network. Without Dr. Chen's hospital system, they had nowhere to send patients for procedures, no facility affiliations, no insurance coverage. The clinic closed within 2 months. My father couldn't find another practice that would take him. Word had spread about the gastroenterologist who couldn't diagnose esophageal cancer in his own son. My mother's nurse practitioner license came under review for advising a post-surgical cancer patient to hide medical equipment for social appearances. They tried apologizing once through my grandmother. They didn't understand how serious it was. They've lost everything. Can you help them? But a gastroenterologist not understanding that a 3-centimeter esophageal tumor is serious isn't a small mistake. And losing everything only after public exposure isn't real remorse. 6 months post-surgery, I completed chemotherapy. The cancer showed no signs of recurrence. I learned to eat small amounts, adjusted to my reconstructed digestive system, returned to work part-time. Dr. Chen invited me to speak at a medical conference on patient advocacy. Your case changed how we think about family medical dismissal. We've implemented new protocols for second opinions when family members question diagnoses. 1 year post-surgery, I celebrated remission with Chris, my friends, and Dr. Chen. We toasted to survival, to doctors who believe their patients, to the importance of trusting expertise over ego. My phone buzzed with a text from Dad. Heard about your 1-year remission. We're glad you're healthy. We've had to leave medicine. Hoping we can talk. I deleted it. Because being glad I'm healthy after telling me to skip life-saving cancer surgery isn't real concern. And losing your medical careers only after your son's surgeon exposed your incompetence isn't real understanding. It's consequence. 18 months cancer-free, and I've learned the hardest lesson. Sometimes the most dangerous medical advice comes from family members with decades of experience and massive blind spots. The feeding tube scar reminds me every day. I trusted a thoracic oncologist I'd just met over the gastroenterologist father who'd raised me. And that trust saved my life while exposing how someone can practice medicine for 30 years and still not recognize when their own son is dying. Some families will never see your suffering until it destroys their professional lives. And by then, you've already learned that survival means trusting the doctors who actually looked at your scans over the family members who dismissed them to protect their reputations.